Hi, my name is Criselda Martinez-Jimenez, and I'll be talking about my physical activity throughout the semester. The CDC guidelines for adults for moderate physical activity they would recommend 150 minutes per week, and for vigorous physical activity they recommend 75 minutes per week for an adult. For children and adolescents, they recommend that children and adolescents stay active for at least 60 minutes a day, and to impact the physical activity on disease and prevention and treatment. For physical activity, what helps is that it helps with sleep. It also helps with memory. It also helps with heart diseases such as blood pressure, cancer, diabetes type 1 and type 2 diabetes, and pre-diabetic patients. It also helps with the brain health, and it also helps manage weight, and it strengthens bones and muscles. Sometimes they use it for treatments such as arthritis. It helps reduce pain. It also helps patients with mood and their quality of life. Like I mentioned before, it helps with type 2 diabetes. It actually helps control the blood sugar. For aerobic moderate intensity minutes, as you can see, I do have a lot of minutes from from week 3 to 7, and as you can see, week 8 and 9 it was a little bit low. For vigorous aerobic physical activity on my graph, I have week 6 through 8 being the strongest, and week 15. And of course, week 2, I did a lot of it. And for strength training, I did more like towards week 10 to 13, week 4 to 5, but I did a little bit less week 7 through week 9. And here, some of the activities that I did were like barbell squats, dance, walking, soccer, yoga, squats, bike riding with my kids, swimming. We did a lot of swimming, jump rope, kettlebell, running, and jogging. As you can tell, like a lot of these things, it's more like for moms, like for myself, because I am a single parent of 2 toddlers. So I try to include my children in my daily physical activity. I feel like I am doing enough physical activity to reduce the risk of diabetes, heart disease, and weight management. I do want to say that I work as a medical assistant at an outpatient facility, and I noticed that once I started like doing more physical activity, my blood sugar was actually going down a lot. So before I started doing this physical activity, my blood sugar level was normally at 115 to 116. So which kind of gives you the pre-diabetic, so then once I started doing the physical activity, my blood sugar ended up going down to at least 97. And so I did put down here that it helps reduce the risk of diseases, and I plan to also watch my diet because I did modify a lot on my diet. I started eating less greasy foods and eating out. I plan on staying more physically active with myself, making sure that I get enough activities throughout the day, such as running, taking my children with me, and I plan on following the CDC guidelines to stay healthy.